This is Dr. Yoon. Yesterday, I had an opportunity to shovel some snow. There was close to 2 feet of snow. It was really thick snow, and spent close to hour and a half shoveling it. But this morning, getting up, as I expected, I felt some tenderness in different parts of my body. Typically around my elbow and around the wrist. It's that constant repetitive movement which created usage of the muscles that I normally don't use, and which form of lactic acid due to anaerobic respiration. And that creates a byproduct of lactic acids, which leads to muscle ache and soreness, a lot of soreness in their body. And that soreness manifests to tenderness upon touch, tenderness upon movement, and achiness and soreness. So I feel it around my bicep tendon, and typically the attachment to my left elbow. And the tender spot actually manifests around this region right here. And when I put pressure on it, I feel sore, but it feels good at the same time. And that tenderness goes all the way down to the back of the wrist into my wrist and into my thumb as well. Being a provider, healthcare provider, not only do I do chiropractic care, which is specific adjustment to the spine and to the joints, we do use a lot of tools to help with patients to recover in their soft tissue, such as their muscles and tendons. And some of the tools that I use is acupuncture, the instrument that I use to help break the scar tissue and adhesions of the muscles. Now, I do believe that the sooner that you manage these tender spots, sooner that you get rid of the lactic acid, the sooner the body will not form muscle tension, chronic tension, spasm, and that could lead into trigger points. Of course, I'm a huge proponent of stretching and warming up the body, but sometimes the person does need some professional help. And some of these helps that we do is using acupuncture to release trigger points and lactic acid as well. Typically, I do acupuncture in conjunction with my treatment, and it works very, very well with relieving muscular tension to help loosen up the joint so we can actually adjust and manipulate the joint much more easier. And we use heat, we use laser, shockwave, but I just want to give you a quick demonstration of some acupuncture and some joint. Kind of clean the area that needs to be treated with acupuncture. And they're very thin, and they're all kind of encased in these pre-packages. And I am feeling some tenderness around this region, which goes in. When I actually bend the arm, there's a crease, and I insert the needle and I spin it. And what I actually feel is kind of a dull, achy sensation as I do this. It doesn't hurt, but I definitely can feel the needle being inserted. And the second point that I usually do is about an inch lower in this region. And sometimes as I do this, you can actually see a muscular twitching. And that twitching is a sign the tension in the muscle is being relieved. The third needle that I like to put is between the thumb and the index finger. Typically, that's a acupuncture point called large intestine 5. And this is the point that I insert. Now, what I'm actually feeling right now is not just this area, but I actually feel a dull ache around this region going into my index finger, into my middle finger, into my wrist. So that's actually a trigger point refer pain that I'm actually experiencing. That around, there's that twitch right there, okay? I feel it around this component, the lateral side of the elbow, into the forearm. And same thing here. Now, I would also do acupuncture around my shoulder joint. Since it's not exposed, I'm not going to be demonstrating it, but there are points like large intestine 15 and TW14 on the back side, which is the anterior and posterior component of deltoid muscle, which is also a connection to the bicep muscle, as I explained yesterday, from your shoulder to the inside of the elbow. So these are so typically I leave this for a few minutes and, manually stimulating these areas to also take the pressure off. Motion to the wrist, and I feel a lot more stretch. I could be using the Graston. Graston 2 is a stainless steel instrument that's specifically designed with a bevel edge. And typically using this instrument to help release the tension of the tendons is quite beneficial. This kind of motion, and what I'm doing is using this beveled edge to catch the areas that are tight, catch the area that could potentially be creating adhesion and scar tissue due to imbalances of the muscles and tendons. And for me, it actually feels very, very good. It feels quite good, and it has a really good relief. And you can see that there's some reddening, and that's quite normal. And sometimes with Graston or other types of instrument-assisted mobilization, it could lead to some form of bruising. And as we do this, it's actually breaking down a lot of the scar tissue, breaking down some unnecessary tissue that hinders proper movement, proper biomechanics of the joint. So working all the extensor muscles and tendons to help break the scar tissue. So once we're done with that, how do I feel right now? I feel warm blood flow around the area. So there's more increased blood flow, which means there's more nutrient to help recover, break all the unnecessary scar tissue. And my suggestion is after this, you gotta be drinking quite a bit of water to allow the fluid to go inside your body to flush out all these unnecessary toxins or adhesions that we broke. Now, after this, I don't want you to go out and work out again. You need some time for the body to recover and rest. And some of the things that we do after this is we can use a K-tape or kinesio tape to help support the muscle, to give some reinforcement, and so allow proper motion. And doing stretches after this, doing some wrist movement, and then stretching the muscles and tendons will take a lot of the pressure off and giving the body a chance to actually recover. So how do I feel now? I feel like my right elbow needs the same type of work as well. And this area feels a lot looser. And so when there's a lot less pressure in this area, it's gonna put a lot less pressure on the wrist, as well as the shoulder, and eventually also the neck. Now the acupuncture and Graston can be done in different parts of the body. It doesn't have to be necessarily around the elbow. It could be done on the neck, shoulder, lower back. It's great for neurological problems such as sciatica. It's great for conditions such as carpal tunnel syndrome. It's great for conditions such related to whiplash, associated disorder, where the muscles are all strained and causing tension. But this is one of the tools, several tools that we use in our clinic to better improve the function and support of the musculoskeletal system to our clients. And so this is Dr. Yoon. Hopefully this helped you out and give you a little bit of insight what could be done to prevent any further injuries from happening down the road. Take care now.